Hello. Yes, I hope you guys are doing good. Now, as we have today, we have psychiatry nursing under the nursing category of medical students arena. Now, in this chapter, as I've mentioned in the group, we're going to cover several topics, but just within the time brackets of we are limited with time, so we're just going to cover the possible units under psychiatry nursing, and that is introduction, concept of mental health and mental illness, check on characteristic of mental health person. Majority of people think that they're healthy mentally until they are disapproved or maybe proven otherwise. So we're also going to check on the criteria for assessment of mental health. How can you know that somebody has mental illness? Okay, we're going to check what are the manifestation of a mentally ill person. So common term used in psychiatry are going to also be checked. Historical trends in psychiatry nursing globally and in Kenya. And then finally, we will conclude on development of psychiatry and mental health services in Kenya. So, just from what you are seeing, first of all, welcome in this session of today. So, so of course, this course introduces the students to the basic concept of mental health and illness. And also covered is what is also covered is the process of admitting and discharging patients who are mentally ill. I'm sure you've been taught about the voluntary form and involuntary form. There are people who are mentally ill and they reject, they don't accept. So these ones are always taken to the hospital forcefully. We know how we admit them and we can discharge them. And we are people who they themselves determine or they actually diagnose themselves for mentally being ill and then they take themselves to the hospital. So we are going to check on how mental health are treated and managed, yes, and in both community level and any other place. So we are just going to acquire the entire knowledge and skills about the mental health, and that is where we're going to start from. So let's go to the introduction directly. Now, there are things to do with introduction here, and what I want to tell you about, the concept of mental health and mental illness. We are going to check on the concept of mental health and mental illness. I'm sure you understand what is mental health. When we talk about you being unhealthy mentally, it means that your brain, okay, just is defined as the stimulation success. Like for example, for any other human being to excel in their working area, for you to be in position to go to class one high school and finish your course and then have a family, have a job, and work completely well, it is governed by internal factors and external factors. Internal factors are within your consciousness, your thoughts, your mind. And then external factors are environmentally acquired from your working, from your schooling, the team you're having, okay? So they can influence you in a way that you are no longer yourself. So you divert from your norm to abnormality without you knowing. Because it can come in with a lot of other symptoms. You can be easily agitated, more of annoyed. You can have some psychic characters, okay? So mental health is defined as simultaneous success at working, loving, and creating with the capacity for mature and flexible resolution of conflict between instinct, conscious, and other people and reality. That is according to Evelyn and Wasili in 1986. But according to the World Health Organization, now mental health in this case is a state of emotional well-being which enables one to function comfortably within society and to be satisfied with one's own achievements. So mental health will refer to the ability of for individual to carry out their social role and to be able to adapt to the environment. Once in a while, you've been in a rural home, you realize some people walk naked. In the village market, you can realize some people, they are dirty, they throw themselves on the ground and they shout, they talk. They are not having direct physical ailments, but these guys are mentally disrupted. To mean that your well being is not merely the absence of disease or infirmity, but it comes along with all these other possibility that is to do with your social life, your physical, your mental, and your spiritual part of it. So either way, if these things are misaligned, they can either affect your physical health or they can affect your social or even the mental or even the spiritual life. You realize there are some people, like in the case of Shakahola, that was now spiritual life which has been distorted. Okay, so that is that. Now let's check on the characteristic of mentally healthy person. When you're healthy mentally, first of all, you'll be feeling comfortable about yourself, oneself. Like you don't have panic, you don't overthink, you don't procrastinate, you are good. You can smile when there's something to be smiled about. You respond emotionally according to the situation. Not that you find somebody is very furious, he is frown for no any any reason. You find somebody is overly excited, he is ever laughing over petty matter. So that does not conform to mentally healthy person. But feeling comfortable about oneself, completely comfortable, that is awareness of self, insights, and understanding of motives. These are weakness and potential. You know yourself. You know what people are intending to speak about you. You're going directly to the situation the way it's supposed to be. You know what is a desire. You understand your weakness and potentials. Living in the real world, you don't hallucinate. You don't have hallucination. You don't hallucinate. You're living in the real world. It means that you don't push the reality away from you, but you accept the way it is, and then you adapt towards it. Realize these guys who are into drugs, the ones who are creating their small world, the bang users, the alcohol users, they they tend to even forget what the real world looks like. So when you're trying to help them to quit the drugs by explaining to them what it will be after they have quit, realize there is a difference. Like you'll get it somehow distinguishable how they understand the real world. It's not according the way the real world is. Having a sense of personal worth and importance, having a sense of personal security, able to solve problems through own initiatives and efforts, those are all characteristics of mentally healthy person. So sometimes you don't even know, you think you're normal, but you're not. Okay? If you are insecure by yourself, or maybe by your spouse, or maybe your friend, you need to talk about that, you need to handle that, because that is not healthy mentally. So if you cannot solve your problem alone, but you run away from them, your girlfriend goes home because the real world is not enabling her to do some proper things that she would admire to do. That's not solving a problem. You should be directly approaching the problem, mentally able, and with your own initiatives and effort, and solve them. So away from that, capacity to work, you should be good, a sense of responsibility and duty, a feeling of being wanted and loved as well. So we have other characteristic of normal person like capacity to get along with other people, appreciating differences between people, being able to give and accept love, being able to plan ahead and fear the future, being able to develop a philosophy in life with meaning and purpose to daily activities. There are people who have they have overdone themselves in alcoholic, maybe drug abuse in a way that they don't fear the future. The Gen Z goes to the demonstration and the bullets are point to their friends. Some of them are shot, but then they still continue going. They're not mentally healthy. Now there are people who are already bulletproof in terms of love. You cannot give and accept love. To mean you don't understand what is love. You don't know it because maybe from the previous heartbreak, disruption in relationship, or maybe you've never had a chance to have one. So with that, you're not mentally healthy. You should be able to feel the essence of love because it is there for human beings. Another thing is being able to develop philosophy in life with meaning and purpose to daily activities. That is also able, that is also enabling, that is also fortifying what we call the mental health. Away from that, let's check on the criteria for assessment of mental health. How will you know that somebody is not healthy mentally? So first of all, we check on the adequate contact with reality. There are people who now they have lost it all in reality in a way that they will tend to even take half of the day sleeping because they don't want to wake up. The reality is like rebuking them. They have already rejected. Some of them even make peace with the death. Normally say if it reaches a point where you make peace with death, That is now end, the terminal end of everything. So look at this: control of thoughts and imagination. If we are assessing somebody who is not mentally healthy, the thoughts and imaginations, some of them even have very crooked imagination. Some of them tend to think that now they are possessed with the Holy Spirit. They can now prophetize. They can actually tell you predictions. They talk alone. Some of them end up going to Jivanji Garden and start forming some small congregation of fellowship and preach to them their own interpretation of Bible. So control of thoughts and imagination. Realize a small baby who is on a psychiatric ward, realize that talks alone, tells you many things, tends to be more knowledgeable and thought-wise than even the adults. They're not able to control their thoughts and imagination. So you get to realize that when you start getting these spooky stories from them, that is a declaration that these people are off from reality and they are not mentally healthy. Efficiency in work and playing. If somebody was focused, was encouraged to do work, and then suddenly there's a regress on work and all that, that motivation maybe due to depression, maybe due to any associates, that is an indication of, somebody who is having mental health issues. Social acceptance, cannot social with other people. Positive image of self, they lack the positive image of their self. They don't have emotional life, those are not mentally healthy. A healthy emotional life is a assessment criteria for somebody who is petty, like he always responds so fast, sensitive to even petty words, get agitated. Most of these things are even directly connected to their past life when they are brought up. Some of them were brought up with one parent, single mothers or single fathers. Some of them had both parents, but they were never able to provide that uttermost love to their children. So it ended up destroying and damaging them completely. So healthy emotional life, positive image of self, social acceptance, all that one. Somebody is already has no hope in their lives, so they have no positive image of themselves. Their dressing conduct is poor. They don't even bathe. They have lost it already in the mental health. So yeah, let's check on the mental illness. Define the definition of mental illness. Okay. Now, mental illness is defined as a disorder with psychological or behavioral manifestation, and it will impair functions due to social, psychological, genetic, and physical, chemical, biological disturbance. So when you have mental illness, it's not directly into psychological or maybe mental, but sometimes it can be because of social. When you're rebuked and you're forced away from your social group, maybe class, maybe your spouse, like your wife or your husband. Maybe it's because of genetic. In your village, almost everybody went mad. Sometimes it is physical. You have a trauma from an accident which makes you mad. Chemical biological disturbance in your hormones also can also bring this. So when it gives you a disorder, which are psychological or behavioral manifestations, and cause you to have impairment of function, we term you to be mentally ill. So that is where we get the mental illness. Okay. So a mentally ill person may have at least one of the following characteristic: one, being dissatisfied with one's ability and accomplishment; having ineffective or unsatisfying interpersonal relationships; dissatisfaction, what we call the dissatisfaction with one's place in the world, like they are not actually okay with where they are at the moment. So having ineffective or unsatisfying interpersonal relationships also, and being dissatisfied with one's ability and accomplishment also comes into play. So common term used in psychiatry. You have psychiatry, which is a branch in psychological medicine dealing with diagnosis, treatment, and prevention of mental illness. You have psychiatric nursing. which is now what we are handling right now. This is just a specialized branch of nursing that deals with the preventing, promoting, curative, and rehabilitative aspect of mentally ill persons in hospitals and community. Then you have psychoanalysis, a method of treating certain types of psychological condition. Then you have child psychiatry, since the science of feeling or cursing disorders of psychic in children. Geriatric psychiatry, a branch in psychiatry dealing with disorders of the aged. Community psychiatry, a branch of psychiatry concerned with the provision and delivery of coordinated programs of mental health care to specified community and population. And then let's check on the historical trends in psychiatric nursing and globally in Kenya and in Kenya as well. So psychiatric nursing and the understanding of the mental illness with which it associates has developed in several approaches through the centuries. We have those days when we had what we call demon, like from the word demon, demonological period. So these are the earliest record of persons believed to have suffered from mental illness related to King Nebuchadnezzar, if you can remember in the Bible. So he ate grass, believing that he was an ox. Another example is Ajax, who actually impaled himself on a sword. Okay. During that time, people believed that the cause of mental illness was demons, and the treatment was quite harsh, degrading and dehumanizing and beating and chaining and locking the individual up in a dark room, and they throw the individual into rivers and ponds. So the patients who escaped with this harsh treatment survived on stealing food or eating wild fruit, while animals ate up those who inadvertently wandered into the forest. Then we had from the monological period, we had political period. So this period is associated with King Edward II of England. During that time, a law was passed in the parliament to protect the property of the mental sick. In the year 1403, the Sisters of the Order of St. Mary managed to start a facility to care for the mentally sick at Bedlam, and the facility was able to accommodate 6 patients only. Thereafter, other hospitals followed the example. So the cause of mental illness, however, was still thought to be demons. The treatment remained more or less as in the demonological period. So the facilities were often dark, humid, and infested with lice, overcrowded, leading to mass death outbreak. Okay, and then in the early 18th century, the first qualified nurse was appointed to look after the mentally ill by Edward Tyson. However, although qualified, the nurse appointed to look after the mentally sick were equally harsh to patients. Men and women were housed together, and members of the public used to visit these facilities as a form of entertainment. So it was at St. Luke's Hospital in the London where this form of entertainment was eventually banned. And in order to enforce the policy, members of the public were only allowed to see the mentally ill maybe once or something. Okay, so then we have the humanitarian period. During this period, reforms of the patient care system for the mentally ill began in France, followed by Britain and later America. And the reform in France started in 1793 at Bicenter Hospital in Paris, the Bicenter Hospital in Paris. So Dr. Philip Pinel and chained a group of patients who had been in chains for 30 years. So he advocated for kindness for mentally sick persons, and as a result, there were marked improvement in mentally sick patients. And then William Took started reforms in Britain in 1796. He advocated humane treatment of the mentally sick, and that, in addition, introduced what we today call occupation therapy. Okay, so both men and women assisted attendants in their daily work activities, and it is worth noting that so far members of our staff were not specifically trained to deal with mental health issues. And then in 1808, a bill was passed to regulate the treatment of mental health patients. And in America, Dorothea Linda Dix introduced reforms after visiting Britain and seeing how mentally sick persons were improving after getting reform type of management. So in 1841, she managed to have a bill passed in Parliament to regulate the treatment of the mentally sick in America. Then we have the scientific period, which is current right now. The scientific period is associated with the 19th century. So during that period, science was devoted to developing modern treatments that were based on scientific findings. So many forms of treatment were discovered and later abandoned, like hydrotherapy, insulin therapy, and leucotomy. So the current forms of treatment include physical treatment like pharmacotherapy and electroconvulsive treatment therapy, we'll call that. There are also various psychological treatment which include individual group psychotherapy, behavioral therapy, occupational therapy, rehabilitation, cognitive therapy, and counseling. So development of psychiatry and mental health service in Kenya. The current Madhari Hospital was started in July 1910 as a lunatic asylum. That is 1910. So before then, the facility served as a smallpox isolation center, and the asylum was renamed Matari Mental Hospital in 1924. And the care was mainly custodial, taking place in dark, gloomy, and often damp conditions. Europeans, Africans, and Asians were managed separately, and the quality of mental health care provided was at least better. So Madari was only mental hospital until 1962. Then we call Decentralization of Mental Health Service Act. Other facilities began to spring up, including a 22-bed psychiatric unit in Nakuru in 1962, and then Machakos 1963, Nyeri and Murang in 1964, and Portrees and Kakamega in 1965. So currently, all provincial hospitals have operational psychiatric units. However, only some district hospitals have operational psychiatric units. Outpatient psychiatric clinics have been established in most of the district hospitals, and Matari Hospital is being redeveloped. And future plan is to intensify community-based psychiatric services all over the country. And it's worth noting that the community psychiatry is also working on that. So, training of mental health workers. The training of enrolled psychiatric nurses was started in 1961 and later changed into post-enrolled psychiatric nursing courses. So, in 1963, the first two registered psychiatric nurses were trained overseas. In 1979, a post-basic diploma in psychiatric nursing was started in Kenya. And then between 1972 and 1982, most psychiatrists received overseas training and the Institute of Psychiatry in England. So then that is that. So we'll check on the theories of personality development. Okay. And before then, we'll check onto that. But I think as for now, that is what is going to follow. Now I think we are done with the development of psychiatry and mental health service in Kenya, and that is the end of our session today, being on Thursday. The next Thursday, when we'll be having psychiatry nursing, we'll handle the same. So check on your groups and have yourself tested on those multiple choices question, the MCQ that are following on the same. Thank you so much. Enjoy your day.